everyone. Welcome to today's live session. I am Dr. Mohan Raut from Dr. Raut's Center for Reproductive Immunology in Mumbai. We specialize in clinical reproductive immunology, helping couples who are struggling with repeated miscarriages, recurrent IVF failures, and unexplained infertility through our cutting edge ImmuLIT treatment, which is a branded and patented process. Today, we are diving into one important topic, and that is how ImmuLIT can be combined with other fertility treatments to improve pregnancy outcomes. If you or someone you know is facing challenges in conception despite IVF, IUI, or even other fertility treatments, this session is for you. So stay with us till the end. So let's start with the basics. What is ImmuLIT? Now, ImmuLIT is an advanced reproductive immunology treatment which is designed to modulate the immune system in couples who experience infertility, especially those with repeated miscarriages, recurrent IVF failures, and unexplained infertility. Many couples don't realize that an overactive or imbalanced immune response can be a hidden cause of failed pregnancies. ImmuLIT works by improving immune tolerance, thus allowing proper embryo implantation and healthy pregnancy growth. So now let us see why we should consider immunological treatment in the first place. Firstly, the immune system has dual role. It protects the body from infections, but it must also tolerate an embryo, which is a semi-allogenic entity. Second, there is immune dysfunction in infertility and pregnancy loss because overactive immune response can lead to implantation failure or recurrent miscarriages. Inadequate immune response will lead to poor embryo support and pregnancy complications. Third thing, in unexplained infertility and IVF failures, almost 15 to 30% of infertility cases remain unexplained. Immune factors could be the missing link in those cases. Repeated IVF failures, despite good embryo quality, may indicate an immunological issue. Fourth thing, in recurrent pregnancy loss, that is RPL, 50% of RPL cases have no clear cause. Immune dysregulation can be the major factor in these cases. So why conventional treatments may not be enough? Because IVF optimizes the embryo quality, but it doesn't address the maternal immune acceptance, very important. And therefore, immunomodulation can enhance implantation and help in sustenance of pregnancy. So now let us see how does ImmuLIT work in combination with other fertility treatments like IVF, ICSI and IUI. Firstly, IVF and ICSI, that is in vitro fertilization and intracytoplasmic sperm injections. For couples with recurrent implantation failures, ImmuLIT helps by regulating NK cells, T regulatory cells, and cytokine balance, and thus improving embryo receptivity. The research has shown that combining reproductive immunology interventions with IVF increases implantation rates and it reduces the miscarriage rate. In case of IUI, that is intrauterine insemination, if there is unexplained infertility which remains after multiple IUIs, then ImmuLIT can enhance uterine immune tolerance, which allows better sperm-egg interaction and implantation. Thirdly, in case of donor egg or donor embryo programs, where in these cases, immune rejection of donor embryos is suspected and therefore ImmuLIT can improve immune adaptation leading to better success rate. I want to share actually real life success stories from our patients who have combined ImmuLIT with fertility treatment. I remember one 35-year-old patient who had 5 IVF failures due to unexplained implantation failures, and after the immunological test, it indicated immunological problem. So we treated her with ImmuLIT, and after that, you will be surprised she conceived naturally. And she did not require a subsequent IVF, and she was really happy after that. And there are many cases like this. Second was a couple who had repeated pregnancy losses. There were 5 miscarriages, and she was told that she will not carry pregnancy anytime, she will require only surrogacy. Her investigations indicated immunological problem. We gave her the ImmuLIT treatment followed by the immunomodulatory medications, and this patient conceived naturally again and had a successful pregnancy. In the third case, this woman had unexplained infertility. Everything was normal, IUIs had failed, but she had high TNF alpha, and which indicated an immunological problem. We treated her with ImmuLIT, and after that, the TNF alpha came back to normal, and she conceived naturally. So this is an important thing, that ImmuLIT helps these patients of unexplained reproductive failures. So what should be what the takeaway from this session? That if you are facing repeated IVF failures, miscarriages, or unexplained infertility, immune factors might be important in such cases. So ImmuLIT can be a game changer when combined with standard fertility treatments. Consulting a reproductive immunology expert can help to personalize your treatment for the best outcomes. If you are a fertility specialist listening to this, we encourage collaboration with us to help your patients achieve success in their fertility journey. Visit our website www.icprm.in to learn more or to book a consultation. Thank you all for joining. If you have found this helpful, please like, share, and follow us for more insights on reproductive immunology and fertility treatments. See you in our next session, and you can always contact us on our helpline number +91 9833 20 15